Hi, everyone. I'm Natalie DeMeis. I'm here to do an educational session on Medicare. So I'm going to share my screen and we'll talk through the different parts of Medicare. So the idea is we'll talk about what is Medicare, who's eligible, understanding the different parts, understanding what's covered and what may not be covered, and also what to consider in selecting a plan. If you have emails, if you have questions, you can email me at benefits@barnumfg.com. You can also put a question in the chat. So down to the basics. What is Medicare? Medicare is a federal program that was designed in the late 1960s to provide health insurance to individuals who are over age 65, those under 65 who are also on Social Security disability, as well as people of any age if they have end-stage renal disease. In order to be eligible for Medicare, you must be fully insured, meaning you must have worked and paid into Medicare for a minimum of 10 years. And that could be either through your own work history or your spouse's work history. You also must be a citizen or a permanent resident of the United States. The government gives us Medicare Part A and Medicare Part B. I'm going to talk into each one of them individually. So once you have what the government gives you, the A and B, you have an option. Your first option is to enroll in a supplement plan, plus a prescription drug plan or a Part D plan, or your second option is to enroll in a Medicare Advantage plan or a Part C plan. So back to what the government gives us. The government gives us Medicare Part A. Again, if you've paid into Medicare for all those years, there's no premium, no cost to you to have Medicare Part A. If you don't have all the work history or you're new to this country and you don't have that, you could buy into Medicare. You would have to pay about $506 a month in order to have Medicare Part A. Medicare Part A is really for skilled nursing care, hospital care, hospice care, really institutionalized care. Again, no premium. What happens is there's a deductible. The deductible is $1,600 for a hospital stay. And that's per benefit period. After that, there could be additional costs if you're in the hospital for over 60 days. And there's no cap to what your out-of-pocket exposure is. So if you're there for a couple of months, this could get very, very expensive. So this, again, is what the government gives us. With Medicare Part B, it's really for care outside of the hospital. It's doctors, labs, MRIs, physical therapy, again, things that don't happen typically in an institution. There is a premium for Medicare Part B. The standard Part B premium is $164.90. And then there's a deductible. The deductible for 2023 is, that's wrong, it's going to be $226 per year. After that, with straight Medicare, you'd be responsible for a 20% copay. And then you'd also be responsible for excess charges. So if a provider wants, they can charge you an extra 15% on top of the Medicare approved charge. And again, there's no out-of-pocket limit. So when you look at these expenses, if I have to go to the doctor and I have to pay 20%, it's not a lot of money. But if I have to go to the emergency room, if I need chemotherapy and I have to pay a 20%, these costs can get very high very quickly. I mentioned with the Part B, there's a premium associated with it. Their standard Part B premium is $164.90. This Part B premium is based on my tax return from 2 years prior. So it's 2023, so they'll look at my 2021 tax return. If I file my taxes single and my modified adjusted gross income is below $97,000, I'll pay the standard Part B premium. If I file my taxes jointly, then my modified adjusted gross income could be as high as $194,000, and then we'd pay the $164.90. If our income was higher in 2021, let's say it was $250,000. My husband and I, we filed our taxes, and our modified adjusted gross was $250,000. We're going to pay a higher Part B premium. We're also going to pay what they call a Part D income-related monthly adjustment. So our total Part B cost would be $361.20 for each of us. So sometimes I get the question, well, I work, my spouse doesn't work. Why are they paying the higher premium? Well, the reason being is it's how you file your taxes. If you file your taxes jointly, They're going to look at your joint return to calculate the number. If we're married and do filing separate tax returns, again, one of us might have a lower premium, but the other one of us might have a much higher premium. So it's important to take a look at these things. The other question I get is, well, in 2021, I was working. In 2023, I will not be working. There is a form that you can fill out. It's called the Income Related Monthly Adjustment Event Form. On this form, I could say, hey, I was working in 2021. I'm no longer working. Please consider reducing my Part B premium. And I've had many people actually get that approved. So it's definitely worth taking that into consideration if that's the issue with you. The biggest question I get, and why people really like to participate in these plans, is what do I have to do and when do I have to do it? So when do you want to enroll in Medicare Part A and Medicare Part B? If you're already collecting Social Security, you'll automatically be enrolled in Medicare Part A and Medicare Part B right before your 65th birthday. So if my birthday is March 3rd, on March 1st, I will have been enrolled in Medicare Part A and Medicare Part B. It's always the first of the month you turn 65. Unless your birthday happens to be the first of the month, then it's the first of the prior month of the month you turn 65. So this will happen automatically. So let's say I'm collecting Social Security and I'm enrolled in A and B, but I'm covered under my spouse's group health insurance plan. When I get my card, I could just send them a note back on the back of the card saying, I don't need my Part B. Can you please cancel that? This way I don't have to pay for my Part B premium. You're automatically given the Part A and you cannot get rid of that. So you must keep the Part A. If I am turning 65 and I need health insurance, then I actually need to do something. 3 months before I turn 65, there's a form I can do online. There's paper forms I can do. And I would send that into Social Security saying, I'm turning 65. I'd like to enroll in Medicare Part A and Part B. If I do that the 3 months before I turn 65, again, my coverage starts the first of the month I turn 65. If I do it the month I'm turning 65, my coverage is effective first of the following month. So again, if I need this health insurance, I must do this. The next example is someone who's over age 65, and they're either still working or still covered under their employment or their spouse's employment. That being the case, again, you need to do something in order to enroll in Medicare Part A and Medicare Part B. The rule is that within 8 months of leaving employment or losing coverage, whichever is earlier, I must apply for Medicare Part A and Part B in order not to have any penalties moving forward. So, I hear people that, well, I'm 70, my employer gave me a retirement package. They're going to provide my health insurance for 12 months, so I don't need this. That's not necessarily the case. Again, the Medicare rule is that you must apply for A and B. A lot of people already have the A, but then you have to apply for the B within 8 months of losing coverage or losing employment, which happens first. So within the 8 months, I would apply for the Part B. I could let my employer continue paying for my health insurance. And then before that expires, then I can enroll in my secondary insurance of either a supplement with a drug plan or a Medicare Advantage plan. If I do not enroll when I'm supposed to enroll, then what will happen is that there could be a penalty for enrolling late. So if I was supposed to enroll and I didn't, the penalty could be financial, and there's also a time period penalty. So it's important to know what the rules are. If you're not sure what the rules are, don't ask your sister and don't ask your neighbor. Either call 1-800-Medicare or call someone who knows the rules that can say to you, based on your situation, this is when you should enroll, and these are the ramifications if you don't. So you really want to understand that. And Medicare, 1-800-Medicare is a great resource for that. Once you have Medicare Part A and Medicare Part B, remember I mentioned to you, there's really two choices. The first choice that I had listed there was enrolling in a supplement or a Medigap plan. Those two words are interchangeable. They both mean the same thing. They're designed to cover some to all of your out-of-pocket expenses, including co-payments, co-insurance, and deductibles. They are sold by private insurance companies. The government does not sell Medigap plans. They're sold by private insurance companies, and they allow you to see any Medicare provider anywhere in the country for a Medicare service. You don't have to ask them, do you accept this plan or do you accept that plan? Say, do you accept Medicare? If they accept Medicare, then you're fine. You must have Medicare Part A and Medicare Part B. And then you must enroll in a separate standalone Part D plan. You cannot have a Medicare Advantage plan and also be enrolled in a supplement plan. So when we look at the options for the Medicare supplement or Medigap plans, they go from the letter A to the letter N. Really what varies for these plans is their coverage, what's covered, and their pricing. But recognize that the plans are federally regulated from the Center for Medicare Services, CMS, and that every G plan must have the same things in there. Every N plan must have at a minimum the same things in there. But the differences between one insurance company and another is really their price and some of the value-added services or benefits that might be available through them. Again, I mentioned there's Plan A through Plan N, and this chart gets pretty busy, but these are all the plans that are available. To simplify it, here's 3 plans we're going to talk about. The Plan F, if you have someone that you're taking care of, someone older, they're probably in a Plan F because that was the most comprehensive plan years ago. It's no longer available to those who are turning 65 now. The most comprehensive plan, when I say comprehensive, meaning it covers the most, is the Plan G. With this Plan G, everything is covered. All Medicare expenses are covered except for that Part B deductible of $226. Under the Plan N, the Plan N is a little less expensive. And in addition to the $226 that you'd be responsible, you're also responsible for a $20 copay for your doctor visit, whether it's your primary or a specialist, $50 for an urgent care or emergency room visit. And then if that provider charges an excess charge, you'd also be responsible for that amount. When we looked at Medicare, it's important to understand what's covered and what's not covered. So under Medicare, personal or custodial care, long-term care services are not covered. And I use this as an example because when you look at Medicare, it says it covers 100 days of skilled nursing care. The key word there is skilled. If I have a stroke, I'm in the hospital for a couple days, and then I need some additional therapy, so I go into a skilled nursing facility. And they're providing me twice a day physical therapy, speech therapy, occupational therapy. All of a sudden, day 20 comes along and they say, well, Natalie hasn't really improved much. Day 21, again, no improvement. As soon as I stop showing signs of improvement, it's no longer skilled care. It becomes personal custodial care, which means Medicare will stop paying and so will my supplement. Then I'd be responsible for that on my own. Other things that are not covered are concierge medicine. A lot of providers are saying, okay, pay me X number of dollars per year and you'll have better access to me. Medicare will not reimburse for that. Services from providers who opt out of Medicare. Again, you still have to ask the provider, do you accept Medicare? If they accept Medicare, then you're covered. You can go to that provider. If they don't accept Medicare, you cannot go, or you could go, but you'd be paying 100% out of your pocket. Because medic surgery is not covered, massage therapy is not covered, care while traveling outside of the United States. So recognize while Medicare does not cover it, many of the supplements will cover care for you outside of the United States. Vision, Medicare will cover things having to do with your eyes as far as retina, glaucoma, cataracts. It will not pay for your refractions exam, and it will not pay for glasses or contacts. So that's where the vision piece comes in. And then dental and hearing is not covered by Medicare, but again, may be available to you through riders or value-added benefits from one plan to another. Once you have a supplement or a drug plan, you must also enroll in a Medicare Part D prescription drug plan. They're designed to lower the cost of your prescription drugs. They are managed by private insurance companies. It does not have to be the same insurance company that you purchase your supplement plan from. You must live in the plan service area, and these costs vary from preferred to standard pharmacies. So I have some people say, well, I like to go to my local pharmacy. I want to make sure I can go there. Well, you can go there, but recognize which plans allow you to go there and what your out-of-pocket expense is going to be by going to that local pharmacy. Prescription drugs are also covered under most Medicare Advantage plans, but again, it's really important to note that if you do not enroll in a Part D plan When you're first eligible, there may be a penalty for each month you should have enrolled and you couldn't enroll, as well as a time period penalty because you could only enroll during certain parts of the year. Many people say, well, I don't take any medication. I really don't like to take medication, so I really don't need this. Well, recognize that I don't think anyone likes taking their medication, but today you don't take any medication, but tomorrow you may need medication. So you want to make sure you have a plan that will cover you at least for the future. So we're lucky that there's a lot of companies that came out with very low cost Part D plans just to get you in there. And then if you need a prescription, there might be a deductible. So you're paying higher in the beginning, but the idea is at least to have coverage. You want to make sure you have some protection if you need it. When you look at the prescription drug plans, you want to look each plan underneath an insurance company has their own formulary tiers. Your tier 1 is typically your generics, tier 2, your non-preferred generics, tier 3 is brand name, tier 4, non-preferred brand name, and tier 5 is a specialty tier. So each prescription plan will have different tiers. I might take a prescription where it's a tier 3 with one company and a tier 2 with another company, which can have a huge impact on what my out-of-pocket expense is. When I talk to people about selecting Medicare plans, the first thing I'll ask is, what is your zip code? What are your prescriptions? And what is your preferred pharmacy? Take a look at that first, and then you work around everything else again. And this is something you should look at year after year, because looking at these plans from one year to another, from one plan to another, can be a big difference in cost based on your prescriptions and the tiering of your prescriptions. Many of you have probably heard of something called the donut hole or the coverage gap. So with Medicare Part D plans, and it's all Medicare Part D plans, there's a couple different stages. Many of the plans have a deductible. The most they can charge for a deductible in 2023 is $505. After that, you have that initial coverage level. During that initial coverage level, you'll pay a specific copay for a specific tier, depending on what the tier is. Well, then what happens is they add up everything that you've paid and what the insurance company has paid for that prescription. If it ever totals over $4,600, you're going to go into what they call the gap. During the gap, you're paying 25% of the cost of the prescriptions. So if I'm taking a $10 prescription and I'm paying $2.50, not a big deal. But if I'm paying a $10,000 a month prescription, 25% could be $2,500. It could get very expensive very, very quickly. Again, that's why you want to make sure you're looking at the plan and how your prescriptions will be treated under those plans. Then there's another calculation. It's called a true out-of-pocket. I've tried to calculate it. It's very difficult because it's not only what you paid, what the insurance company paid, but it's also some pharmaceutical discounts, and there's other things that go into this calculation. If that hits over $7,000, you go into what they call catastrophic coverage. And during catastrophic, you're responsible for 5% of the cost of the prescription. I have clients who are in and out of they go into catastrophic the first month that they're enrolled in a plan because the cost of their prescriptions are so high. I have a lot of people who never even touch catastrophic. So again, it really depends on what your prescriptions are and what the costs are to really make a decision or to make an impact of what that cost would look like. So we talked about supplement plans. We talked about the drug plans. Now we're going to talk about Part C plans, Medicare Advantage plan. With the Part C plans, they're designed to cover your hospital, your doctors, and your prescription drugs in one plan. So this Part C plan. When they started, they were all HMO plans, and there's still some HMO plans out there. Now, many of the companies are providing PPO plans. So what's the difference? With an HMO plan, you're only allowed to see the providers that are in their network. So not only must that provider accept Medicare, they must accept that insurance company's plan. You must be in that plan. With a preferred provider organization, you have lower cost sharing if the provider's in network. But if the provider is not in network, you can still go. You're just going to have some higher copays. You might have to jump through a couple more hoops to get that coverage. You might have to prepay and then get reimbursed, but it does allow you to see out-of-network providers, provided they still accept Medicare. With Medicare plans, there's also some special needs plans. These special needs plans can provide for low income subsidies. So if I make a small income, I might be eligible for some financial support. There's nursing home special needs plans. So if I'm institutionalized, I'm in a skilled nursing facility or some type of rehab, there's certain plans I can enroll in while in there. And then they have chronic condition special needs plans. So sometimes it's based on one chronic condition, sometimes it's based on multiple chronic conditions, but based on my diagnosis from my provider, I might be eligible for one of these special needs plans. With Medicare Advantage plan, there are quite a few Medicare Advantage plans. For any one zip code, there could be over 30 Medicare Advantage plans, so it gets very complicated and very confusing. Here's a sampling of 6 Medicare Advantage plans, all of which have a 0 premium. After you pay your Part B premium, there's no additional premium that's due on these plans. And then what happens is there's different copays. So you can see the premium is 0. And for these copays, you have a maximum out of pocket. This maximum out of pocket is for medical services, doctors, hospitals, labs, MRIs, surgeries, hospitalization, chemotherapy, anything medical. Your prescriptions, the dental, other things are not included in that maximum out of pocket. Most of them, the maximum out of pocket is in that range of the $6,700. Some plans have a deductible, some plans don't. Some plans have a deductible day one. Some plans have a deductible only for certain services. So it's important to understand how it works. Then when you look at it, your primary care, not very expensive, $0 to $10 for your primary care. Specialists are ranging anywhere from $35 to $45. So every time you go is you have a copayment. And again, but you won't hit more than $6,700 in a calendar year. Most of the plans do not require a referral to see a specialist. And they have copays. Again, you can see lab services, urgent care, surgery, hospitalization. You can see there's copays for all of these things. Again, up to that maximum out of pocket. So people say, well, how do I figure this out? Well, even on these plans, you want to look at your prescriptions first. You want to see how they're treated under these Medicare Advantage plans. Then you want to look at your doctors. Are my doctors in network, or am I willing to switch my doctors to see a different doctor that might be in that plan's network? All things being equal, then you want to look at some of the value added benefits here on the bottom. I know I'm going to need a hearing aid. Well, which plan has the better hearing aid benefits for me to enroll in? I need glasses. How much are they going to give me toward a pair of glasses? Do they have a gym membership? Do I have coverage outside the country? Maybe I go to my hometown, for 3 months every year in another country. What's the best coverage for me outside of the United States? Who provides the better dental? And newer this past couple of years is something called an over-the-counter benefit. So these plans will give you a certain dollar amount to be used for things that you need to keep yourself healthy, but the insurance company doesn't pay for. So it might be some people for the heart take a baby aspirin every day. Some people take extra vitamin D or vitamin C, Band-Aids, things like that you need on a regular basis that aren't covered by your insurance company. They give you dollars to spend every 3 months for those types of services. So again, you can see there's lots of different plans, lots of different options, and it can get pretty confusing. When we look at a supplement plan versus a Medicare Advantage plan, with a supplement plan, you are paying a higher premium, but you have lower out-of-pocket expenses. With an Advantage plan, you have low to no premium, but with higher out-of-pocket costs. On a supplement plan, your providers provide national coverage. So as long as they accept Medicare, you're fine. You can go to that plan. Where an Advantage plan, there's a network of providers. So you want to make sure your doctors, your hospitals, your labs are all in network here. As far as coverage, for a supplement plan, only covers medical. You must purchase a separate standalone prescription drug plan, and typically does not include dental or vision or hearing on these plans. But with a Medicare Advantage plan, most of them do include a prescription drug component. Plus, they offer some extra things. For example, they do offer an annual physical, where a Medicare supplement offers a first-time welcome to Medicare physical. After that, an annual wellness visit that's treated differently. But with the Advantage plan, they do offer an annual physical. And again, these plans offer quite a few times extra benefits like the dental, vision, and hearing. When you're looking at plans and you're looking at option, you want to better understand what's covered and what's not covered. You want to know, is my provider in the network? Are you willing to go to any hospital or any provider to see a specialist? When we're looking at cost is so much more than premium. You want to not only look at the premium, but you also want to look at the co-insurance, co-payments, deductibles. What's the maximum that I'd be responsible for out of my own pocket to help me understand the difference from one plan to another plan? For my prescriptions, how are my prescriptions treated under the different plans and their different formularies? Do you want to find out, is there a prior authorization required for my prescription? Is the pharmacy I like to go to a preferred pharmacy, or is it a standard pharmacy, or is it not included as a pharmacy at all? These are the important things to take a look at. And I'll say it a few times, with prescriptions, you want to look at your plans annually for your prescriptions, because this will change for you year after year. Traveling, are you out of the state or out of the country parts of the year? If I have 3 children in 3 different states, I might go visiting them. You want to know what your coverage will be while you're out of your hometown, right? Out of there. And then do they have coverage for outside of the United States? Star ratings, this is newer, and I think they're really starting to get a hang of this. So this is a score that each plan has. So one insurance company might have 3 plans. Each plan would have its own star rating. These star ratings are determined by member surveys, the plan's responses, providers. It's an overall performance score saying how good the plan is operating. 5 is the highest rating in these types of plans. They go from 0 to 5. And again, it's to help you decide or compare plans based on quality and performance. These ratings will change and they are updated each fall. So something to look at when you're looking at plans. Once you enroll in a plan, people ask, well, can I change my plan? Well, every year they have the annual enrollment period that goes October 15th to December 7th. With these plans, you get to decide, am I going to keep my same plan? Do I not like the changes my plan is making for the next year? Do I want to make a change to my plan? Again, you want to look at your prescriptions. How are your prescriptions going to be treated that next year? And make sure it's the right plan for you. The question is, though, can I start in a Medicare Advantage plan and then switch over to a Medicare supplement plan in future years? Either because I was diagnosed with something, or maybe I'm a little older and thinking I need a little bit more coverage. We recognize the rules for switching over vary by state. So that if I'm in a state that requires medical underwriting, if I was diagnosed with something and want to switch over to supplement plan, that insurance company could say, sorry, Natalie, we can't take you, or okay, Natalie, we'll take you, but we're going to charge you a higher premium based on how you're answering the medical questions. So you want to know what these rules are before you actually enroll in a plan. In addition to the open annual enrollment period, there's also something called an open enrollment period. That's the first 3 months of the year. So let's say I'm on a Medicare Advantage plan, and come open enrollment this year, I don't make a change to my plan. Then in January, I find out my doctor no longer is in the network, or they treating my prescription drug as a tier 4 instead of a tier 2. I don't want to be in that plan anymore. There's this open enrollment period that goes January 1st to March 31st of every year. It's also available to people who newly enroll in a plan. It gives them 3 months to change their mind and switch out of it. But there you can switch from one Medicare Advantage plan to another, or to switch from a Medicare Advantage plan to a supplement and prescription drug plan, if the insurance company allows you to do that. So you still want to make sure you understand the medical underwriting rules to see if that's a viable option for you. If I move to a different service area, I live in Fairfield County, Connecticut, and I'm moving to upstate New York, I would need to change my plan, either my drug plan or my supplement plan or my Medicare Advantage plan. So you must do that within 60 days of moving. So it's important to take a look at that. And then if in your service area, and that's based on your zip code, there's a 5-star plan, you can enroll in that 5-star plan at any time throughout the year. You don't have to wait for one of these enrollment periods. When we look at resources, recognize that there's quite a few resources out there. Medicare is a great resource. I mentioned it a couple of times. The phone number is easy, 1-800-Medicare. You can call them and say, hey, I'm turning 65. I want to make sure I'm enrolling when I'm supposed to. Can you help me with that? they're a great resource. Their website, medicare.gov, or their publication, Medicare and You, has a lot of information in there that can help you make decisions. Social Security, based on what your questions are great resources for you. And then Barnum. Barnum is a great resource. Here's a phone number for us if you have any questions that we didn't answer today. One thing I recognize that we didn't talk about, but I want to bring back is, people who are enrolling in Medicare Part A, while they're covered under their employer plan, recognize that you cannot be enrolled in Medicare Part A and also contribute to a health savings account. I'm going to say it again. If you're enrolled in Medicare Part A, you cannot enroll in a health savings contributions to a health savings account. And there's tax implications with that. So if you're in that situation, you definitely want to talk to someone and make sure you're doing what makes the most sense for you. Questions? Are there any questions for anybody? I don't think I see anything in the chat. Okay. Well, thank you for your time today. Again, we're available. If you have any additional questions, feel free to reach out to us on whatever it may be, picking a plan, understanding the different rules and when to apply, when what's covered, what's not covered. We're here to help you. I hope you guys have a great day.